I'm Zenia Chow. I'm an ear, nose and throat surgeon with a specialty interest in facial plastic surgery, but I also treat a wide variety of general ear, nose and throat conditions for children, also up to adults, ranging from hearing loss, ear infections, tonsillitis, sore throat and sinus conditions. So yeah, there are a lot of ear, nose and throat conditions that can be quite severe and impact especially children's development and growth. We know that in particular untreated sleep apnea or severe snoring in children does have a harmful impact on their brain development, their growth as well, their weight and also their concentration at school. And so hence my role as an ear, nose and throat doctor is to identify these issues at an early age and then manage them appropriately. It's really important to have preventative measures, especially from an early age group, because that's the critical years of development in children's behaviour and also their general health. So if we can detect issues early on in kids' lives, for example, hearing loss, which is very detrimental to their overall schooling and development, and manage it appropriately and prevent these from causing long-term consequences and long-term hearing loss, then this will set the child up for a good future and development. There are a lot of preventative measures that we can institute from a primary health level, that is at the local level with the general practitioners and developmental nurses and paediatricians, all the way through to my role as an ear, nose and throat specialist. One of the fundamental things is just general health and nutrition. If someone is not eating well, having the appropriate nutrients and vitamins and basic hygiene, and we know that in developing nations and even up in the Indigenous population in Australia, that's one of the big challenges that we face, and that certainly does have an impact on the number of ear infections that they may have and also the response to treatment as well. So that's a very basic measure that we can all institute at a very early age. And then moving on from that, we can then manage ear symptoms and ear pain and infections with the appropriate antibiotics if that is required. A lot of these cases, it can be very conservatively managed without antibiotics as well, with keeping the nose as clear as possible with nasal sprays and flushes and simple nose blowing as well. So if children or adults have any ear, nose and throat conditions that they're concerned about or not responding to the usual modes of management, they can certainly contact the doctors at the Vineyard Medical Centre to make an appointment to see me here on site, or contact my office directly or through my website as well to inquire further.